I'm Bianca Joy Catherine. I work for ACLIN Uganda. ACLIN means African Queens and Women Cultural Leaders Network. And in ACLIN, we are empowering the girl child and protecting her to become a better citizen and be more self-reliant than it has been in the past.
I'm Jennifer Baitamasa. I work with Navigators of Development Association, an organization that works with communities on women empowerment, land rights, women rights, and environmental rights.
My name is John Kibega. I am a journalist working with the Cousin Jema News. Cousin Jema News is an online news platform founded by journalists in this region, ensure that we could create a platform that will focus on the events of human rights nature in the Albertan region. But I'm also a freelance journalist with the United Nations Radio Kiswahili unit.
I am Superintendent of Police Irama Vincent Uri. I am a police officer. I work in Masindi as the district police commander. On a daily basis, my main job, as mandated, is to protect life and property of the citizens, all the people who live here. So, and then of course, as we do that, we do law enforcement generally on the different laws that exist in the country.
My name is Kisembo Fred. I work with Masindi District Local Government as a Senior Assistant Chief Administrative Officer. Therefore, I'm an administrator.
I'm called Asekenye Joyce, Coordinator Teso Karamoja Women Initiative for Peace, based in Kumi, and coordinator for the organization, which is a woman-led organization. What I do as a coordinator for Teso Karamoja Women Initiative for Peace, I am a human rights defender.
My name is Benson Ekwio Chen. I'm the team lead of Public Affairs Center Uganda, an indigenous organization operating at the subnational level. We operate in the Teso, Karamoja, Sebei, and recently we have extended our stretch to Acholi sub-region, Western Nile, and Lango.
I'm Bahebwa Longino Biagagaire, Deputy Resident District Commissioner Masindi.
My name is Deborah Chirago. I work with RDP Uganda as a program volunteer. What we do on a daily basis, we have a program called I Pay the Bribe. We record cases. We do follow up to make sure that justice prevails.
My name is Hope Bagota. I work with Uganda Human Rights Commission, Hoima Regional Office, that is in charge of the Bunyoro region and Chankwanzi. We have 9 districts under our jurisdiction. That is Hoima, Masindi, Kiriandongo, Chikube, Bulisa, Chibale, Kagadi, Kakumiro, and Chankwanzi.
My name is Julius Opoi. I am known as Mr. OJ. I am a musician with disability from Soroti. I use my music to reach the message to the communities that people with disabilities are people who are able people in communities. So people should be able to support them in one way or the other. I work with an organization called OJ Disability Care Foundation. My initiative that I formed to support persons with disability in terms of advocating for their rights, since there are so many spaces on discriminations on the rights of persons with disability. So the organization is championing the issue of advocacy on the rights of persons with disability in Soroti in so many ways, in terms of accessibility, information, in terms of economic empowerment, in terms of providing mobility?
I'm Akelo Agnes. I work for Iteso Cultural Union under the Culture Department. And every day we do a lot on culture, especially ensuring the rights of the young ladies down there in the village and all the women, and also their male counterparts.
I'm called Paul Aolio. I'm a superintendent of prisons by rank. I work with the Uganda Prison Service, and currently I'm working at the regional office Eastern as the Human Resource Officer, or in our technical language, Staff Officer.
My name is David Wetaka. I do some work with the Slum Dwellers International, but Uganda chapter. And what we do is advocacy for land rights, especially in the slums or the informal settlements around Bale, in the settlements of Namatala, settlements of Moni, almost where we are standing, and Namakwekwe especially.
When I first heard of COVID-19 outbreak in Uganda, of course, as a human rights defender, a journalist, I also got scared. First of all, my life was also at risk because the reports were saying that it was a global pandemic and everybody was susceptible. Then secondly, we had fears because some of the employees, people we are working with, started cancelling some contracts for fear of the bill because they were expecting the income to narrow down. And secondly was the challenge of movement. There were movement restrictions imposed immediately, and in the first week or 2 weeks we were not able to move because we had no permits that were being given from Kampala. For us who were up country, there was no mechanism of that kind until the second week when the HRDs were allowed to give us permits to allow us to travel. So absolutely it remained a challenge because much as we were told to travel, we didn't have the resources because we were supposed to hire a motorcycle if you were to ride from here up to Chigorovia or Lake Albert to see how the communities are making life. So you don't have the money demanded you to move with your permit, hire a motorcycle at around 70,000 shillings. A journey that could take 20,000 shillings if it's normal time. So in those days immediately we could not move on. The work did not go well until of late when the restrictions were a little bit relaxed. Now we can move, but still, it is still challenging because you need to have a lot of money, or sometimes you are forced to drive a car, which is expensive, looking for a story.
The news of COVID-19 was received with shock because all our work had to go to a standstill as we are majorly based in communities. We work with communities, so meaning us going into the lockdown, we are supposed to be home, close offices, not meet our communities, and those people that like help address their rights in mediations, locus visits, walking to offices to access justice could no longer find us. We could also not find them to help them since our movements were limited.
COVID-19 is a pandemic that scared all of us, or most of us, because we didn't know what we were dealing with. It just opened our minds to assess ourselves. How are we prepared for risk? How do we assess risk? How do we plan for risk management? And it has greatly affected us, particularly in the region, or as a regional office, because we are unable to meet the people that we serve. As I had earlier on informed you, that through our promotion mandate, we move out to the communities. Why we move out to the communities is to reach the farthest person, a person who won't ordinarily come to Hoima. We are in charge of 9 districts, and we are very alive to the fact that not everyone can come to Hoima to access our services for various reasons.
I was in the office alone. It affected me badly because by then I was the head of District Task Force COVID-19, of which on daily basis we could have meetings to raise strategies and form committees, case management committee, surveillance committee, social mobilization committee. There were about 4 committees.
When COVID came in, first of all, I feared for my life as a person. The fact that I was in a district where I don't stay, I don't have any family, what came to my mind was like, I need to go back home. That affected my work simply because I went back home and the lockdown got me there. There is no way I could access other offices of the people we work with to do the follow-up on some cases. Then the other thing that I felt about COVID, of course, we used to hear a lot of conspiracies running around that the black people are not affected by COVID. So when COVID came in, at first I was like, no, it is not COVID. But then I realized it was real. I used to fear for my life. You fear to meet some people because you don't trust them, you don't know where they slept, you don't know how they run, the different people they meet. So it limits your work because those people you cannot meet them.
When we got our first case of COVID-19, positive case in Uganda, it was a concern to me because as a citizen, we realized the lifestyle of our citizens, the way we interact with one another. And one method of the spread of the disease is through close contact and sharing. So I was a bit worried that we will have a very big problem like we see in other continents or in other countries. As a police officer, of course, this brings in a lot of challenge in enforcing the law. Because imagine a situation where you have a suspect who is positive with COVID-19, and yet he has committed, say, a capital offense. He has killed someone. As a police officer, I'm restrained because if I don't have PPEs, how do I go ahead and enforce the law on this person? How will I arrest him or her? So it is a big challenge. So balancing between our health and the job that we are supposed to do is still a big question. Because much as there is the disease, but the law enforcement must continue.
First of all, we were very scared because most of us were told we have to keep indoors. Whenever you called friends, they would say we haven't even gone out of the houses, we've been indoors. So that increased stress among our members, but we kept calling each other and encouraging each other. In fact, some women would call and they wanted counseling because they were not used to staying at home for all those long hours, because we are used to going out to work, meet groups of women and youth and train them. So if we had to stay at home, it was a big challenge. One, we could not communicate, we could not support the people we've been supporting, and we had challenges with the violence against children in homes, especially the girls. Some of them have been harassed and abused by their relatives. So it has been a very challenging situation.
Before COVID came, we had already made our work plans. And now, because of COVID-19, what we had planned has not been implemented because of the lockdown. During the lockdown time, we were not accessing transport. It was very difficult to get to places that we used to go, like holding meetings or dialogue meetings at community level. It was very difficult. Then also follow-up of some of the cases that we were handling was not easy, and up to now, it is still a challenge to us. So our plans have been distorted completely because of COVID-19.
COVID affected me as a human rights defender in one way or the other. First, most of the places in Soroti, they are inaccessible. They are not inclusive. They are not inclusive for persons with disabilities. So sometimes it was very difficult. Actually, it's very difficult for you to go and access certain information that you need maybe to be cleared on or to get clarifications on. So you find that due to inaccessible places, it affected my life. Secondly, as a human rights defender, there's a time when the President of the Republic of Uganda put what we call total lockdown. And for us as persons with disabilities, we use other people to transport us. So you find that the lockdown was there, the movements was not allowed, but there are some situations whereby somebody needs to go somewhere to do something. It favored those ones with the foot who could maneuver their ways out in terms of, using a border. So it affected me so much as a human rights defender, because my right to movement in terms of accessing other places was not taken or into consideration under the SOPs which was set by that time. Also, as a person with disability, you find that as a human rights defender, access to information on COVID-19 was limited. You find that my colleagues who are the deaf people were left out because these informations are not in the brailles. They are only information that you see on newspapers, and you need to read and find out what is this. Many places maybe these people are learned, but they don't have radios. Even if they say that this was on radios, not all Ugandans own radio stations.
It's true, since March we have had a very big challenge because of COVID-19. One, it has affected my work in the sense that movement was literally blocked or limited, and therefore, like with my staff, officers who would need to come to me to seek for guidance, counseling, and even get information from the office were not able to do it.
Very importantly, that for the first 3 months of the coming of COVID, we were in total lockdown. That and as I spoke about the informal settlements where I do most of the work, you are aware that these are people who work from hand to mouth, and so it affected them adversely in a way that some of them could not provide for the basic necessities. And as a person who has been relating with them, somehow constrained. And as you are aware, very many of the agencies are donor funded, and so it was so difficult for us to come into terms with the challenges that came by the COVID.
For a credible election, I think the Electoral Commission has to raise awareness to the voters and make them aware of their rights, inform them of the dangers of selling their vote, and also educate them on a need to do an election and observe human rights during the election time to make it free and fair. And it should, the Electoral Commission should organize it in a way that it is participatory. All categories of people are involved in it, and they should be encouraged. Be it the youth, the PWDs, they should also be encouraged to come up so that the election has a fair representation.
Yeah, with COVID, it's a real big challenge, because our women would have done better, because we're encouraging women to become leaders in the society, because when women become leaders, they address women issues in the community, because as women, we are mothers, we are wives and responsible people in our communities. But most of the women do not have the smartphones, they cannot access radios and TVs in the villages, so most of them missed out, and some did not even participate in the elections because they didn't get information. Information is moving very slowly in our villages. So with this type of elections, most of our women didn't vote. And because we are told to keep distance, it was a very challenging situation. Lining behind someone, women were scared, because they know if you line behind someone and that person doesn't go through, they will feel bad. And if you don't line behind someone who has gone through, he or she may not support you. So most of the women were discouraged, and most of them stayed at home in their gardens.
Okay.
Yeah.
The hybrid form of election, what I see is that most of the human rights defenders might be challenged to the sense that they are not able to do their work normally, because some of the human rights defenders don't have the capacity to use the technologies available to be able to communicate on time. That should be appreciated, I think, by everybody, because if somebody is in Kaisatonia, it provides room for rigging and human rights abuses during elections because of movements. Because if movements are still restricted, no gatherings, it means somebody with the capacity, if he has a car, he can move from here and there and coordinate so fast. He will be faster than the human rights defenders. So which means during that time, if it were possible, human rights defenders need to be empowered to have, maybe if you can talk of data on their phones, to get smartphones for those who don't have, and be able to have the skill of using these virtual mechanisms of communication, like we are talking of Zoom and the like.
The elections must take place, yes. And I think the Electoral Commission has guided on how it should be. But you can imagine people are more agitated to having elections their way than following the guidelines given by the Electoral Commission, and those also the scientists in the country have guided on how this should be done. Basic. For instance, the Ministry of Health talks about social distancing, wearing face masks. What we have seen is people are adamant to observing the guidelines and SOPs of Ministry of Health or World Health Organization on the prevention of the disease. They think a vote is more important than their life. And as the police, you know, we have a challenge of the numbers. The election is not taking place in one place of the country, not in one village. It's taking place in all the villages in all over the country. So now to have a police officer in every village is practically impossible as it is now. We can't have a policeman in every village. Even if we did, a village comprises of more than 200 people. Yeah, there are more than 200, maybe 1,000 people in one village. What can one policeman do at a polling station where you are having about 500 people voting, mature people, okay, who are not orderly? So this becomes a challenge. It's a very difficult task. It's not easy to enforce. I can't say it is impossible, it's not easy. But I think all of us, the human rights defenders and other stakeholders, must appreciate that there's a challenge. So it's very important. We should all gear, first of all, to health, and then we come to the political and civil rights. But most important is our right to health, and right to life should be protected before we go into the political and civil rights of the individuals. So that's where we have a little bit of a challenge. So the elections, we'll see it as it moves, but there's a bit of a problem.
It has caused a lot of enmity, one. Then there is a lot of domestic violence, whereby in a family you find that a woman or a wife had an interest in a specific person that she wanted to vote for. But because we are exposed to standing behind one, it has been a fear, because these women were not free to stand, because she feared that if she did it, when she goes back home, it will be a problem. And some of them were beaten. We've already got some reports. Some of them had fear. After standing behind my back, she decided just to walk to their home direct. So all this has been something that was not, in fact, scientifically, as I first heard. When I heard the word scientific elections, I thought everything was going to be done in a scientific, smart way. But it has not really come the way I thought it would be. And instead, it has caused a lot of enmity, and some people lost their lives, some people are hospitalized, and there was a lot of chaos, and there was no trust in these elections, if I could say.
This is going to be an election of money, an election of power and relative powerful connections, an election that is likely going to be marred with a lot of violence. And here, I think the life and the role of HRDs is most likely going to be threatened, because we have been raising these issues on radio, and already you get feedback. Who are you? We are already campaigning some people. And I tell them that, but if you want to be an MP and you are flagrantly floating the electoral laws, I thought an MP is going to make a law. And if you are going to make a law which everybody must respect, you must be seen to be respecting the law. And nobody is doing that. The same person who's aspiring to be a lawmaker is openly, there are even those who park their cars, come out, people line up, and they dish without fear of favor. And they are well connected. So I think, so it is going to be an election of money. It is going to be an election of violence, because always violence is associated with money. There is no way I can invest my 6 billion. And I've seen it even with the opposition. Because here we had a case where in FDC, where somebody said, I have been in this ground for 2 years. I've invested a lot. Then somebody who came just for 2 months, he has defeated me in this election. No way. And actually, virtually, all have picked forms. I've seen those who say they lost in the primaries. I've also picked. And sometimes they are just, because if the process is mad. But my interest is what difference will it make? So I think this is going to be the toughest election in our history. And it's going to be a real test of, and we get worried, we really get worried whether the courts, because already NRM has over 350 and they have even failed. Nominations have started. They have not even started reviewing them. So what are you going to do? What will now happen with the general election? We might have over last time we had over 170 petitions. This time we might get I don't know how many. So I think that is my view, and we need to prepare as HRDs.
Of course, election is broad. It begins with campaign, which now they are calling scientific. But for people to elect their leaders, they need to participate in many things. First of all, it began with the display, voter register, and now people had to campaign, but now they are campaigning on radio, and yet sometimes you need to see body contact of the person you are bound to. How is the person reacting to your questions? How is the person able to express himself? How the person is attracting the audience? But now all this is missed, and we are bound to get many electoral malpractices, like you have had last week when on Friday 4th, when we had elections, primary elections for NRM members of parliament and women MPs. People are already challenging that there were some malpractices. We are likely to get petitions, and in certain instances maybe results will be cancelled. This will inconvenience the Ugandans, but also where they have not tightened, like you would see people in the line, people are not putting on face masks, people are not washing hands, we are not sanitizing, people are I'm fearing that it may is likely to escalate, because you have had in the public offices where they have found maybe 1 or 2 they have closed. Even I had in the morning in a later district they have closed. It's only the cow, the deputy, and the secretary working. So by the time we finish the primaries, we're likely to have many infections from the communities.
We are human rights defenders, defending the rights of our people, defending the rights of defenders. This is what we do. We are human rights defenders, defending the rights of our people, defending the rights of defenders. This is what we do. I'm a human rights defender, defending the rights of my people.